Now, using our 3 steps, let's break this down. So this question's asking actions to include for the key problem, performing a dry dressing change. So the biggest thing we're thinking here is keeping it clean and keeping it dry. So a solution we're looking for are correct ways to change this dressing. So option number 1 is correct. Guys, gauze can be covered with sterile occlusive dressing to keep in place. Option number 2 is incorrect. The dressing should be kept dry, guys, never moist. A dry dressing change is dry. So option 3, 4, and 5 are correct. You guys, you want to clean from in to out, not to introduce any new germs. And option 4, remove the old dressing with clean gloves and always assess the wound while you're there. Now option number 5 is also correct. Washing your hands before and after all patient care here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. So the question here is asking for the priority action of what do you do first? For the problem, patient comes to urgent care with chills, mental status changes, guys, chest pain upon inspiration, a blood pressure that looks normal, heart rate of 80, which is normal, respiratory rate, which is a little bit high at 26, and guys, a pulse ox that is 92 on room air. The biggest thing we're thinking here is assessment first. We're thinking breathing and oxygenation. So the solution we're looking for are addressing respiratory status to prevent that worst possible outcome. So guys, assessment before intervention. So option number 1 is incorrect. Lorazepam doesn't address the patient's assessment findings, and it's technically an intervention. So option 2, assessing the respiratory and cardiac function right now is what we have to do. And option 3 and 4 are incorrect because both are interventions. An aerosol treatment, guys, that's an intervention. And option 4, drinking 2 bottles of water doesn't solve the issue, and it's an intervention. So always assess before doing an intervention. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question is asking what to do next for the key problem here, giving saline enema to a patient who's currently having severe abdominal discomfort and cramping. So guys, the biggest thing that we're thinking here is we're giving too much, too fast, so we either stop or slow it down. So our solution we're looking for is to provide relief for the patient. So option number 1, pain can happen, but it should not be dismissed. Option 2 is correct. Guys, we're stopping, then starting again at a slower rate. That technically can relieve the pain. And option 3 and 4 are incorrect. Getting another enema doesn't solve the issue for pain right now. And option 4, incorrect. Increasing the weight would increase the pain. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question is asking for the incorrect statement for the key problem. The new nurse is discussing getting a wound culture. So the biggest thing we're thinking here is surgical asepsis. So a solution we're looking for are the wrong statements that are made to get this wound culture. So option number 1 and 2 we have to skip because we do label the container, so that should be done. And option 2, starting from in to out. Guys, that is the same as cleaning motion. So we have to do that. Now, option number 3 is technically our option here. We have to choose because sterile gloves are not required to remove old dressing, just clean regular gloves. And option number 4 we have to skip because we keep the swab on the one with only here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question is asking for the incorrect action for the key problem. The student nurse is inserting an NJ tube. So we're immediately thinking size, position, and placement. So guys, we're looking for the wrong solution here, or the wrong action for that NJ tube. Very different than an NG tube. So option 1 and 2 we have to skip, since ice chips promote swallowing and helps advance the tube. And option 2, an NJ tube, is different than an NG tube in that an extra 20 to 30 centimeters are needed to go down to the jejunal. Now, option 3, we have to skip because the head of the bed should be elevated for insertion to decrease that risk of aspiration. So our correct option is number 4 because we're looking for things not to do. Guys, so we don't remove the stylet until the confirmation of placement is made. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. The question here is asking what to include in teaching for the key problem given an in-service about caring for patients who had mastectomies with lymph node involvement. So guys, the biggest thing, anytime you hear the word mastectomy, you're thinking avoid the arm on the affected side and assess for complications. So no blood pressures, no IVs on that affected side where the breast has been removed. So solutions, we're looking for correct care for these types of patients. So option number 1 and 2 are correct. All medical records should be current and include the history. Option 2, arm on the affected side should not be used for IVs or even blood pressures for that matter. Option 3 and 4 are also correct. All staff should be aware of the patient's history. And option 4, arm on the affected side should be avoided for blood pressures, like we just said. And option number 5 is also correct. The arm on the affected side should be avoided for procedures. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking what to correct with a key problem, patient care tech putting a condom cap on an uncircumcised patient who's incontinent. So, biggest thing we're thinking about is foreskin, you can't control the urine, and improper technique. So the solution we're looking for are actions that are not correct here. So, option number 1, 2, and 3 are technically correct. So guys, we're looking for the incorrect options. So adhesive solution to help keep the cap on, that's okay. Option number 2, securing the collection bag lower than the leg, That's okay. And option number 3, space needed at the tip to make sure that urine flows. That's fine. So option number 4, we have to choose because it's incorrect here. Foreskin should not be pulled back from the patient when you're using this condom catheter. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the correct intervention for the key problem of giving norepinephrine IV. Now, giving norepinephrine, this is causing shooting pain and pale skin along the venous pathway. So we're immediately thinking extravasation. So the solution here are the right actions to do for this patient right now. And guys, during any adverse reaction, we always stop the med. So option number 1 is incorrect. Flushing the lines and pushing the med in may cause more damage to the tissue. So option number 2 is correct here. We always stop the medication to stop the damage. And option 3 and 4 are incorrect. So option 3 is not a normal finding. And option 4, we still get the med even if we're giving it slower. So damage will continue. And lastly, option number 5 is correct. Taking out the IV while aspirating will get the med out of the vein there. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the priority action, or what to do right now. For the key problem here, changing a central line dressing on a confused patient that can't really follow directions. So, biggest thing we're thinking here, before looking at the options, are maintaining surgical asepsis and getting help if you need with this irritated patient. So guys, our biggest solution we're looking for is addressing the problem and preventing this worst possible outcome. Now, option 1 and 2 are incorrect here. Visitors can be present as long as they don't interfere with the procedure. And option 2, it's always good to explain to the patient who can't follow directions, but not really a priority here. So option number 3, keep the procedure sterile to avoid infections as well as complications here. And option 4 we had to skip here because it's good to stay therapeutic, but doesn't impact procedure, so it's technically not a priority in this question. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. So this question is asking for the assessment findings for the key problem of a child with a trach who needs suctioning. So the biggest thing we're thinking about is breath sound, respiratory rate, secretions, as well as oxygen saturation. So our solution we're looking for are findings that mean that the child needs airway clearance. Now for options here, all of them are correct. So option number 1, tachycardia is a common sign that suction is needed due to the increased work to breathe. Now option number 2, write this one down. Restlessness can be a sign of hypoxia. That one might be tricky. Now option number 3, tachypnea, or basically rapid breathing, is a sign of respiratory distress. And option 4, bronchi can indicate wet lungs. So indication of suction. And lastly, guys, option number 5, low pulse ox indicates a lack of oxygen and need for airway clearance. So indication of suctioning needed here. Okay, that wraps it up. For more details and test tip, now using our 3 steps, let's break this down. This question is asking for statements to include in the key problem, teaching a nursing student about a 24-hour urine specimen. So before looking at the options, we're already thinking we need to start the 24-hour urine in the AM, we need to waste the void, and it's all in one bottle. So solutions we're looking for are the correct teaching about this procedure. So option number 1 is incorrect. You guys, the first void should be discarded. We always use the next void. Option number 2 is correct. We start in the morning, but we don't use that first void. So guys, write that one down. Now option number 3 and 4 are incorrect. There's no need to use a catheter. The patient can void independently. And option 4 is incorrect. Keep the container at the bedside. You may accidentally use a commode on site that may interrupt the collection. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. Now this question is asking for the incorrect actions for the key problem, suctioning an artificial airway in an unconscious adult patient. So the biggest thing we're thinking about is sterility, initiating the suction when you're coming out, and oxygenation as well as aspiration. So the solutions we're looking for are the wrong things to do when suctioning this patient. So we have to choose option number 1. Guys, 20 seconds is way too long for suctioning. It has to be at least 5 or 10 seconds max. And option 2, we have to skip because technically it's correct. So giving patients breaks in between suctioning allows for ventilation. And option 3, 4, and 5, we have to choose. Since option 3, patients will cough, which is a normal reaction. And option number 4, there's no fluid in the airway, guys. That has risk for aspiration. And lastly, option number 5, sterile procedure. We need sterile gloves, not just clean gloves. So we were looking for the wrong things to do. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question is asking for the priority action, or what does the nurse do first? For the key problem, patient getting blood transfusions suddenly has difficulty breathing, anxiety, palpitations shortly after starting. So guys, immediately, before you look at the options here, you have to think blood reaction, or basically a reaction to that blood infusing. So the solution here is to stop the blood to stop the reaction. So, looking at our options here. Option 1, 2, and 3 are incorrect here. Listening to the bowel sounds doesn't stop the blood reaction. Completing an incident report Now, using our 3 steps, let's break this down. This question is asking for the correct actions to include in the key problem, collecting a urine sample for a dipstick on a toddler who's not potty trained here. So guys, we're just thinking the toddler's still in diapers or they're in trainers. So the solution that we're looking for are appropriate ways to collect this urine from that diaper, from that child. So option number 1 is incorrect. A sterile sample is not needed here, and so cath is unnecessary. It's basically a little bit invasive. Now option number 2 is incorrect. We don't want to sample directly from the diaper, so materials from the diaper can impact the reading. So option number 3 and 4 are correct. Waiting more than 30 minutes can give an inaccurate result, so we want to make sure we're mindful of the time. Option number 4, cotton balls to collect the urine. Guys, that's clean and can extract urine for testing. And option number 5 is incorrect. A toddler isn't potty trained, so they're unable to do this option. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the most accurate documentation here. For the key problem, you're assessing patients with a posterior tibial pulses. So the left is bounding and the right is weak and thready but palpable. So the first thing you're thinking is that the left side is strong and the right side is just really weak and low. So a solution here that we're looking for are documentation that reflects that the left is strong and the right is weak. So option number 1 is incorrect. Now the right side is incorrect, but the left side is 2+, which is normal. Guys, bounding is not normal here. Bounding should be really strong. Option 2 and 3 are incorrect. Using less than the greater than symbol is not appropriate. And option 3, right and left grading indicates normal pulses. So guys, pulses are not normal. So this leaves us with option number 4, which is correct. Right should be a +1, which indicates a weaker but palpable pulse. And since the left side is really strong, 4+ indicates that strong, really bounding pulse there. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the priority action of what the nurse does right now. For the key problem, after NG2 placement in the hospitalized patient. So, before we look at the options, you just place a nasogastric tube. You want to confirm placement before the use. So the solutions we're looking for, we're going to make sure the tube is in place to avoid the worst possible outcome. Now, our first 3 options are incorrect. So option number 1, documenting is needed, but guys, we have to do the placement first. Always assess from the placement. And option number 2 and 3, you cannot use any NG tubes until the placement's confirmed. There's a big aspiration risk. And option number 4 is our correct option. Nasogastric tube placement needs to be confirmed before the use. Okay, that wraps it up. For more details and test tips, please. Now, using our three steps, let's break this down. So this question's asking for the correct action for the key problem: a patient with a recent right ankle surgery who's going down the stairs with a cane. So the first thing I'm thinking about here is the use of a cane for weight bearing with that right foot. So solutions we're looking for are actions that shows the patient is using the cane in the right way. Let's do our options here. So option 1 through 3 are all incorrect. Guys, the cane should be used first, then the affected foot, then the strong leg. So option number 4 is correct. So if you're thinking about this, you should be putting the cane first, balancing on that strong leg, and then advancing that weak leg down the stair first. So you're providing those double end supports for weight bearing. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our three steps, let's break this down. So this question is asking for a priority action, or basically, what does the nurse do first? For the key problem, watching a new grad nurse collect urine for a UA, keyword here, from a urine collection bag. Technically, guys, we can't do that. So the first thing you should be thinking before looking at the options is you need a fresh sample from the patient for an accurate UA. So the solution we're looking for here is ensure that the nurse doesn't use that sample for the UA. So option 1 and 2 are incorrect. Guys, we never mix urine with saline or using it for a test. And option 2, you can't use that sample for a UA if it comes from a bag. So option 3, now that one's correct. You document the amount of urine, but you have to toss it because it can't be used. And option 4 is also incorrect. A sample from a bag, obviously here, can't be used. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our three steps, let's break this down. This question's asking for the priority action. Basically, what do we do first for the key problem, a man that's coughing after eating his steak? So guys, the first thing we're thinking about is obstructed airway. So we have to assess the choking before we do anything. Always, guys, the solution we're looking for here is assessing before an intervention. So option number 1 is the correct option. Assessment always comes before an intervention. So we're asking, which is an assessment, if the patient's choking. Now option number 2, 3, and 4 are incorrect. Guys, CPR is only done if the patient's unresponsive. Abdominal thrusts are done before the back blows. And lastly, option 4, it's good to call 911, but guys, assess the patient first. What if the guy's just coughing? Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our three steps, let's break this down. All right, this question's asking for an assessment finding problem here, for the key problem of assessing a patient who has an order for a blood transfusion. So again, we're looking for the problem with giving this blood transfusion. So the first thing I'm thinking is IV access that's not either 18 gauge or 20 gauge. I'm looking for correct blood, correct equipment, and correct monitoring. So a solution we're looking for are assessment findings that would be a problem before giving this patient blood. So option number 1 and 2 are technically correct. The triple lumen CVL, or central venous line, is okay for giving blood. And option 2, low hemoglobin levels, 7.2, is an indication to get blood. But option 3, that one is the problem. We we can't give blood typically through a 22 gauge, which is a peripheral IV inside the hand. So it's not really a good site to give blood. And option number 4, restraints won't interfere with giving blood, so we can't choose that. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the most appropriate order for the problem: patients going up the stairs with crutches. So the very first thing we're thinking is safety and weight bearing on the hands and the arms. So the solution we're looking for are the correct steps to walk up those stairs with these crutches. Now for our options here. First is option number 1. You put the full body weight on the crutches. Then second, you put the strong leg on the step first. Then third, you put the body weight on the leg that is strong. So basically the leg that we just put on the step there. And lastly, guys, number 4, you move up the step with that strong leg first. Okay, that wraps it up. For more details and test tips, please see the rationale below.